First aid. First aid is the immediate help or attention given to an injured person before proper medical help arrives. First aid can range from cleaning a small wound and covering it with sticking plaster to dealing with serious injuries caused due to a major disaster. It plays a major role in saving lives and speeding an injured person's recovery. Let us study the first aid that has to be administered in the following situations.
First aid for cuts and wounds.
For minor cuts and wounds, wash the affected area with water and apply an antiseptic cream. Cover the area with a clean band-aid or sterile gauze. First aid for burns. For minor burns, hold the affected part under running water for some time. This will cool the wound and avoid further damage. In case of severe burn, do not pour water on the victim as it may cause the victim to go into a state of shock. Apply an antiseptic cream on the affected area. For serious burns, consult a doctor immediately. First aid for fainting spells. Make the person who has fainted lie with his head held lower than the rest of his body. This will allow extra blood to reach the brain. Do not crowd around the victim. Call for an ambulance if the person does not recover after 20 minutes. First aid for insect stings. Insect stings can be very painful. The most important thing is to remove the sting with a pair of tweezers. Apply a paste of baking soda and cold cream to the affected part to relieve the pain. A soft pad soaked with ammonia can also be applied to provide relief. Calamine lotion may be applied to relieve itching. First aid for poisoning. Many commonly use household items like insecticides, pesticides, detergents, naphthalene ball, etc. contain harmful chemicals which can be poisonous if consumed. Hence, it is important to handle such items with care. In case of poisoning, let the person be seated comfortably and call for a doctor immediately. The doctor should be informed about the source and the type of poison consumed. This will help him or her decide on the treatment required for the patient. First aid for animal bites. Animal bites can lead to dangerous disease called rabies. There is no cure for rabies. However, rabies can be prevented if the patient is given proper and immediate treatment by a doctor. In case of an animal bite, the affected area should be washed with soap and water. After applying an antiseptic cream, the patient should be taken to the doctor immediately. In case of a snake bite, a tight bandage should be tied between the wound and the heart. This slows down the speed of poison. The victim should then be rushed to the hospital. So kids, here we have completed our chapter number 8, Safety and First Aid. I hope you must have enjoyed the chapter. So we will meet you in the next class. Till then, stay safe and have a nice day.